BRAINCOM presents. Do you know the symptoms of vitamin B12 deficiency? Well, stick around because we're about to dive deep into this crucial topic. Vitamin B12, also known as cobalamin, is a powerhouse nutrient that our bodies need to perform optimally. It's like the conductor of an orchestra, harmonizing the performance of numerous body functions. From producing red blood cells to supporting the normal function of our nerve cells and being integral to DNA synthesis, vitamin B12 is a star performer. However, our bodies don't naturally produce vitamin B12, we have to get it from dietary sources or supplements. Now here's the catch. Sometimes, due to various reasons like dietary restrictions, health conditions, or age, we might not get enough of this essential nutrient, leading to a deficiency. And this deficiency doesn't go unnoticed. It manifests in various symptoms that could range from mild to severe. Now that we've set the stage, let's move on to the symptoms you should look out for. The first symptom we're going to discuss is fatigue. Now, fatigue can be a common occurrence in our fast-paced lives, but consistent unexplained fatigue may be a sign of something more serious, like a vitamin B12 deficiency. Here's why. Vitamin B12 plays a pivotal role in energy production. It helps in the formation of red blood cells, which carry oxygen to your body's cells. Without enough oxygen, your cells can't function optimally, leading to fatigue. It's like trying to run a car with a low tank of gas. It won't get you very far. Moreover, vitamin B12 is essential for maintaining a healthy nervous system. Without it, you may feel tired and sluggish, but it's not just physical fatigue we're talking about. Mental fatigue, like difficulty concentrating or memory loss, can also be a sign of deficiency. So if you're feeling unusually tired, don't just brush it off. It could be your body's way of telling you that you need more vitamin B12. Another common symptom is weakness. You might notice a general lack of physical strength, a feeling of heaviness in your limbs, or difficulty in performing tasks that used to come easily. This isn't just about feeling a bit off after a long day at work or a tough gym session. It's a pervasive sense of weakness, a certain frailty that creeps in and sticks around. So how does a vitamin B12 deficiency contribute to this? Vitamin B12 plays a crucial role in the formation of red blood cells, which carry oxygen throughout our bodies. When there's a deficiency, these cells can't function properly, leading to anemia. And anemia, my friends, can make you feel weak and tired. Ignoring this symptom can be dangerous. Prolonged weakness may impact your daily life, making simple tasks challenging and potentially leading to falls or injuries. So don't brush it off. Remember, feeling weak isn't just a sign of getting older. Next up, let's talk about changes in your skin color. A less known yet significant symptom of vitamin B12 deficiency is an alteration in your skin's hue. This could manifest as paleness or, in more severe cases, a yellowish tinge to the skin and whites of the eyes, a condition known as jaundice. Now you might be wondering, how does vitamin B12 affect your skin color? Well, vitamin B12 plays a crucial role in the production of DNA, essential for the development of healthy red blood cells. A deficiency can lead to the production of larger, irregularly shaped red blood cells that can't function properly, causing the skin to lose its healthy color. So what's happening here is that the lack of properly functioning red blood cells means less oxygen is being transported to your skin, giving it that pale or jaundiced look. So, keep an eye on any unusual changes in your skin color. Breathlessness and dizziness is another symptom you should watch out for. Now let's dig a little deeper into why this happens. Vitamin B12 plays a vital role in the production of red blood cells. These cells are responsible for carrying oxygen throughout your body. If your body isn't getting enough B12, it can lead to a decrease in red blood cell production, causing anemia. One of the side effects of anemia is a lack of oxygen supply to your body, causing you to feel breathless or dizzy. It's like running a marathon without having trained for it. Your body is working overtime, trying to compensate for the lack of oxygen. This can make simple tasks, like walking up a flight of stairs, feel like a massive effort. So if you find yourself gasping for air after a gentle stroll, or feeling dizzy for no apparent reason, it may be time to check your vitamin B12 levels. Remember, it's not normal to feel breathless or dizzy frequently. Now let's discuss something that could really affect your day-to-day life. Disturbed vision. This is a symptom you should never ignore, as it can be an indicator of vitamin B12 deficiency. Disturbed vision, also known as optic neuropathy, can occur when a deficiency of this vital nutrient damages the optic nerve that leads to your eyes. The damage can disrupt the nervous signal that travels from your eye to your brain, causing vision disturbances. These can manifest as blurred or disturbed vision, shadows or shapes that seem to float across your field of vision, and even sensitivity to light. You might notice these changes gradually, and they may come and go. Vitamin B12 is essential for the health of your nervous system, including your optic nerve. It's crucial to ensure you're getting enough of this nutrient to maintain good vision. So, if your vision is acting up, it might be more than just needing new glasses. Mood changes are another symptom of vitamin B12 deficiency. Now, you might be wondering, how can a vitamin deficiency affect my mood? Well, vitamin B12 plays a crucial role in producing brain chemicals that impact mood and other brain functions. Low levels of B12 are often associated with mood disorders like depression and anxiety. Here's the science. Vitamin B12 aids in the synthesis of serotonin, a chemical responsible for regulating mood. When B12 levels are low, serotonin production can drop, leading to a mood imbalance. This can manifest as feeling down, anxious, or experiencing drastic mood swings. It's important to remember that mood changes can also be a result of many factors, including stress, lack of sleep, and more. However, if you're experiencing mood changes along with other symptoms we've discussed, it might be a sign of vitamin B12 deficiency. Remember, your mental health is just as important as your physical health. A high temperature could also be a sign of vitamin B12 deficiency. Now, you might be wondering how these two are related. Well, let's break it down. Vitamin B12 plays a vital role in your body's ability to produce red blood cells, which carry oxygen to your tissues. When your body doesn't have enough vitamin B12, it struggles to produce these cells, leading to anemia. And guess what one of the symptoms of anemia is? You guessed it, fever or high temperature. This is because your body is working overtime trying to produce more red blood cells, which can raise your body's temperature. This is why a persistent high temperature without any known cause could be a sign of vitamin B12 deficiency. And it's important not to ignore this symptom because an untreated B12 deficiency can lead to more severe anemia, causing further complications. So, if you're running a fever without any known cause, it might be time to check your vitamin B12 levels. Glossitis and mouth ulcers are another symptom of vitamin B12 deficiency. Glossitis is a fancy term for inflammation of the tongue. When you're running low on B12, you might notice your tongue becoming unusually smooth, as the tiny bumps on your tongue called papillae start to disappear. This can make your tongue look shiny and feel sore. Plus, it can mess with your sense of taste. Then we have mouth ulcers. These painful sores inside the mouth are no picnic, and they can be linked to a lack of B12. Deficiency of this crucial vitamin can weaken the lining of your mouth, making it more vulnerable to these nasty ulcers. So, what's happening here? Well, vitamin B12 plays a critical role in cell production, and healthy cells are essential for a healthy tongue and mouth. When B12 levels drop, cell production can go haywire, leading to problems like glossitis and mouth ulcers. So, don't ignore those painful mouth ulcers. Changes in mobility could be a sign of vitamin B12 deficiency. As strange as it might sound, it's true. Vitamin B12 plays a critical role in maintaining the health of your nervous system, and that includes your motor nerves. These are the nerves that control voluntary muscle movement, everything from lifting a cup of coffee to your morning yoga routine. When there's a lack of vitamin B12, these motor nerves can start to malfunction, leading to problems with balance and coordination. You might find yourself stumbling more often, or having difficulty with tasks that require fine motor skills, like buttoning a shirt or tying your shoes. In severe cases, a vitamin B12 deficiency can even lead to muscle weakness or stiffness, making it harder to move around freely. So if you've noticed any changes in your mobility, don't just brush it off as a sign of getting older. It could be a symptom of something more serious. Remember, it's not just about aging. Your mobility issues could be due to vitamin B12 deficiency. Last but certainly not least, digestive problems could be a sign of vitamin B12 deficiency. Now you might be wondering, how does this connect? Well, it's pretty straightforward. Vitamin B12 plays a crucial role in the production of digestive enzymes. These enzymes break down food, helping your body absorb all the nutrients it needs. When there's a deficiency of vitamin B12, enzyme production can take a hit. This could lead to a variety of digestive problems, from nausea and loss of appetite to constipation or diarrhea. In some cases, people might even experience heartburn or a bloated feeling. And it doesn't stop there. Prolonged deficiency of vitamin B12 can lead to serious conditions such as gastritis or even malabsorption syndromes. In these cases, your body doesn't absorb nutrients properly, which can lead to a host of other health issues. So if you're having unexplained digestive issues, it might be due to vitamin B12 deficiency. Well, there you have it, the top 10 symptoms of vitamin B12 deficiency. We've journeyed through a range of signs from the subtle to the glaringly obvious. We've talked about fatigue and weakness, as well as pale or jaundiced skin. We've discussed the unsettling feelings of breathlessness and dizziness, and the disconcerting experience of disturbed vision. We've delved into changes in mood and sudden spikes in temperature, and we've explored the discomfort of glossitis and mouth ulcers. We've also touched on changes in mobility and the often overlooked digestive problems. All of these symptoms are signals from your body, telling you that something just isn't right. In the grand tapestry of health, vitamin B12 plays a crucial role. Its deficiency can lead to a host of problems, making it essential to keep an eye out for these symptoms. Remember, your health is your wealth. Don't ignore these signs. Get checked and stay healthy. If you enjoy this video, give it a thumbs up and share with your friends so we can keep making them. For more videos like this, hit the subscribe button and don't forget to click on the notification bell so then you get notified of our next post. Also, to learn about many other interesting topics, be sure to check our other videos as well. Thanks for watching.